Please welcome CarePay.
Good morning, everyone. My name is Enrique Sucian, and I've been working for CarePay for the past 5 years. I started as a director of product and transitioned my way into the chief growth officer role. This is Feline Welmers, and she's responsible for marketing within CarePay. We want to take you through our journey and our learnings. CarePay has been founded in 2015 in Kenya with the mission to make healthcare accessible and affordable for everyone. We started in Kenya by creating a digital health wallet that has been created on top of the mobile money platform architecture in Kenya. And we had 5 million people actually registered to the platform at the time. This was the start of our journey towards a member-controlled health insurance journey via the mobile phone. As we grew our services, we realized that we actually addressing the #1 problem of Kenyan insurers. And that problem is claim data leakage in the core insurance flow often resulted in inaccurate decision support information. And because of that, it eventually leads to unexpected high claim costs. We also realized later that this was not the only problem in Kenya, but it was a universal problem with many insurers around the world. Claim data leakage often occurs in a traditional landscape. A fragmented situation is happening with 15 to 20 applications for the core insurance flow. Every time an application shares information with another application, data leakage happens. A small quality decrease is happening. And if you then consolidate reporting across all these systems, then you could end up in a 50% data inaccuracy. And together with, if you take into account that the data is typically 15 to 30 days old, it's very tough for an insurer to take decisions in a timely manner and an efficient manner. Due to the lack of timely insights, insurers are forced to keep their traditional behavior, and that's transaction-driven behavior. Transaction-driven behavior is actually focusing only on paying out the claim, or in some countries even not paying out the claim. This fully takes away the focus on the member and their unique needs. CarePay wants to support insurers to change their behavior, and therefore we created a transformative insurance platform that facilitates the real-time connection between insurers, providers, and the members. Our platform simplifies the application landscape with integrated modules that provide standardized and normalized data insights. This now immediately unlocks the possibilities to manage your loss ratio at a daily manner, including AI support with straight-through processing, and manage your fraud, waste, and abuse via AI. Additionally, we have a way to connect real-time IBNR and to make sure that we, to make sure that you don't run the risk of losing money. And the last time, you can even focus on your personalization again. Feline will take us through a demo in what a glimpse of connected data could do.
Yeah, so let me take you through what the possibilities currently are in connected and real-time data insights that are already leveraged by health insurers. And this is just the tip of the iceberg. So the data is connected through CarePay's member app and a payer provider portal into one joint backend. This prevents any data leakage, like Enrique just referred to. This example shows a reimbursement request by Jackie directly shows up for case manager Louise and claims manager Bernard. It allows Yeah, it allows our real-time dashboard to include data insights and business performance metrics from C-suite needs, such as a daily loss ratio and real-time IBNR, to a more granular level metrics that are meant for member-centric product development. So there are a variety of analysis that can be done. This is from your aggregated costs to specific cost drivers, detailed diagnostics trends, geographical distribution of costs, your product effectiveness, and your member behavior. It allows health insurers to take timely, meaningful, and personalized action when needed. Because this is actually the representation of the dashboard that you can see real time, seeing also all the tabs on the top. So what does taking action really mean? Take this case where the loss ratio for March was very high. And at a first glance, you could already see that specific cost drivers were much higher than the expected trend. Secondly, we took a deep dive to really understand what was going on and why by looking at the more granular level data. It led to the outcome of actually engaging very specific healthcare providers for better price and cost agreements.
Thank you, Feline. This is just a tip of the iceberg, like Feline already said. On the short term, these insights drive the shift towards more personalized care journeys, including outcome management and preventive care. And improved bottom line of the insurer, and this all while still increasing the total experience of the member. In the midterm, we will see a lot of AI possibilities in this area. But it is very important to understand that AI only can thrive and can be effective on the basis of normalized and standardized data, like our platform actually brings. On the longer term, a personalized 360 view of the health of a member will be available, including the social well-being information, and all the data will be aggregated from a global health data exchange. This can be managed by the member themselves, and for example, the member can give consent to use the data for different purposes. For example, also data monetization, and get benefits in return for that. We are looking forward to that already. If you want to know more how you can actually leverage your real-time data in your company, please find us in a booth next to this stage. Thank you very much.
Thank you.